This is going to be my module 1 practical video. So first I have to show you my working area. So here is my working area. And this paper is the module 1 video practical assignment patient information. So the first step of this practical is to compare and evaluate the patient's oral health status to their home care practices. So her current health status, oral health status, would be that she has sudden inflammation, and her oral home care is that she brushes 2 times per day and flosses every day. And then you want to identify the reason for the poor oral hygiene, and I think the best reason for this would be the hormones from the pregnancy, since she does say that she she brushes 2 times a day and flosses every day. So I would think that if she's doing it properly, that is a sufficient enough amount of home care. And then you want to provide factual information according to the patient's needs. So a human need for this patient would be that she has an unmet need in wholesale facial image due to the sudden gingival inflammation, as evidenced by that she complains that there is sudden gingival inflammation that has never been there before. And then you want to use the perio chart to indicate the bleeding sites for active disease. And then you want to use the disclosing solution to assess the patient's self-care. And then you want to use open-ended questions and a non-directive technique. And some examples of some open-ended questions would be, what type of mouthwash are you using? Because she is worried about a bad tasting mouthwash. And how long has the gingival inflammation been there? Since she complains about her sudden gingival inflammation. And then you want to make sure that you're listening to the patient more than you're talking to the patient, and you want to use proper problem-solving techniques. And then you want to use the patient's mouth to demonstrate the effects of the disease process in oral care products. And the oral hygiene aid that I would recommend that the patient would use would be to use an oral irrigator for a supplemental technique, or for adjunctive therapy. And then you want to incorporate any supplemental media. So in our case, it would be the Casey videos that we can use. And then you want to demonstrate how to use the oral hygiene aid. So first you would have to point the tip at 90 degrees to the tooth and move along the gingival margin so that the water can go below the gingiva a little bit to clean out any bacteria. And since she is pregnant, I would the oral irrigator would help with removing the inflammatory mediators and any extra bacteria that she's not getting with just regular flossing and brushing. And then after that's done, you want to make sure that the patient is sitting upright, and you want to use characteristics of good instruction. So you want to have small increments, have the patient actively participate, help the patient self-pace themselves, and provide immediate feedback, and provide positive reinforcement. And that concludes the Module 1 practical video assignment. Thank you for watching.